Excellent. Hello and welcome to this recorded webinar on clinical supervision fundamentals. My name is Brent Smith and I'm a clinical educator with Three Rivers Department of Rural Health in the Albury region. My professional background is podiatry. Joining me today is Cassie Biggs. Cassie is a clinical educator also with Three Rivers in the Deniliquin region, and her professional background is nursing. We would like to begin this recording by acknowledging the First Nations peoples who are the traditional custodians of the lands and pay our respects to elders past, present and emerging. Thanks for taking the time to watch this recording on clinical supervision fundamentals. Before we start, it is worth noting that this recorded webinar covers the generic fundamentals of clinical supervision. It does not go into discipline-specific information such as discipline assessment items, as we aim and the intention is to be as broadly applicable as possible to as many health professions. Outcomes which we will cover in this session include understanding the importance of clinical placements and the benefits for professional practice, an increased awareness of what is required with clinical placement provision, knowing how to plan, host, and evaluate clinical placements, and understanding the roles of feedback and assessment in clinical placements and who can participate in these activities. For the first half of this webinar, we are going to discuss the concept of clinical placements. What are they and why are they necessary? We'll also look at what is required with clinical placements, explore some of the benefits and challenges associated with clinical placements, and discuss strategies for getting to know students to maximise successful outcomes. So clinical placements are a mandatory requirement for all health degrees or disciplines offered in Australia. Clinical placements enable the integration of theory and knowledge into professional practice. They also enable the development of clinical skills, critical thinking, and problem solving. The placement structure, timing, and duration varies according to both discipline and university in which the students are from. Clinical placements aim to embed theoretical and academic knowledge through workplace exposure and clinical experience to improve employability and work readiness of graduates. A clinical placement is time spent in the actual professional working environment that a student may be employed in post-graduation. As I've stated, it helps to develop the clinical skills, critical thinking, and problem solving necessary for future practice. Clinical placements also allow for socialisation and immersion for future career locations. Clinical placements are important for clinical skill development and to embed the skills and academic learning in a supported and safe environment, with the supervisor able to provide real-time feedback and prompts for reflection and critical thinking. Clinical education through placements can influence students' development and professional identity, as well as practical knowledge and skills brought about through professional socialisation and practice. In addition, clinical placements are crucial for the development of clinical competence, clinical confidence, time management, organisational skills, and preparedness for independent professional practice. Placement expectations generally tend to be, for the first and second year, they're the shorter, more observational type placements, where the more senior years, whether it be third or fourth year, these tend to be longer duration and with expectations of that of nearing new graduate level. Clinical placements are important for clinicians and organisations because they can help to enable assessment of the students for future employment. Clinical placements can also increase students' awareness and understanding of specific areas of practice, particularly specialty areas or rural practice. They also enable exposure of students to clinical practice areas and organisations for future employment, assisting with workforce recruitment and ultimately, hopefully, retention. Clinical placements can also improve staff knowledge through current theory and evidence-informed practice, increasing the speed of information transfer that occurs with a student on site. They also have the potential to develop staff skills in things such as mentoring, clinical reasoning, organisation, time management, supervision, communication, as well as conflict resolution. Clinical placements can enhance staff collaborative teamwork within and across professions. And with the correct structure and planning, they also have the potential to enable resources to be developed or updated and enable projects to be completed. They can assist clinicians and students to undertake research relevant to the service and the organisation. They can be an avenue for promoting the service within the workplace and the community, and they have been demonstrated to increase productivity and allow for additional service provision. For example, education sessions, which the students can deliver in services, as well as simply an extra set of hands. From our perspective, the rural locations clinical placements occur in can significantly influence recruitment and retention brought about through exposure to practice within rural regions. Many regions and organisations are now adopting a grow your own mentality, assisting with workforce building and renewal. There are many roles and responsibilities associated with clinical placements, and these include organisations need to ensure that they orientate students to the relevant organisational policies and procedures and work health and safety requirements of the workplace. They need to establish an early good working relationship early with students, and this helps to achieve successful outcomes for all involved. Setting placement goals for the placement early and continually review them sets things up for success. Following this process can really help keep the placement on track and increase the likelihood of successful assessment outcomes to be achieved. Clinical educators and organisations need to provide regular and timely feedback, and this needs to be documented as part of the formative and summative assessment processes. By making this feedback regular, timely, as well as documented, this reduces the burden at the end of the placements and also provides evidence, if required, if successful completion of the placement is not achieved. It is important to involve the students in the clinical education process as much as possible. As adult learners, they are also responsible for taking charge of their own learning. So involve them in this as much as possible. It is also important to highlight for clinical educators and organisations to complete all required documentation and student assessments, and for these to be returned as per the required timeframes. The significance of this is some placements lead directly to another or are prerequisites which are attached to a subject impacting academic progression. So delaying these timeframes can really slow down this whole process. It's crucial for clinical educators and organisations to maintain contact with the university, which the student is from, and raise any questions and concerns early regarding students' knowledge or performance on the clinical placement if required. If you have any concerns with this issue, first take it up with the Academic Workplace Learning Coordinator for that subject and discipline, and as well, the clinical educators at Three Rivers Department of Rural Health are here to assist where possible. Everyone has a crucial role to play with clinical placements, and there are multiple stakeholders, and some of these are more obvious than others. While students are at the centre of this model, it's not always the case, depending on the context and situation. In some instances, it may be the community, client or patient, clinical educator or organisation at the centre in focus. But for this model, it's the students. Clinical educators or supervisors, along with the placement organisation, staff, clients and patients of the service are all key to the success of the placement. Without these elements working together, clinical placement simply would not be possible. The university discipline contact is a key stakeholder. They are a valuable resource and should be kept informed of the placement progress, especially if things start to go a little bit south or not go as well as they could. Discipline contacts can provide many tips and strategies to assess the supervisor with you guys in this role. It should also be noted that other health professionals within the organisation can have a role in clinical placement supervision and can provide valuable input and feedback, especially in times where clinical educator absences occur or structured interprofessional learning opportunities. Clinical educators at the Three Rivers Department of Rural Health, we're always here and ready to support you and the students doing clinical placements within our footprint. We are happy to connect when and where needed, so please do not hesitate to reach out and contact us. It's often worth noting that there are other non-clinical personnel that can be involved in the placement, such as administrative staff. These are often under-recognised team members and can provide a great deal of assistance with placements and provide you with valuable feedback when it comes time for the assessments. If there are any questions or concerns with regards to the clinical placement, consider who you can talk to and address concerns as soon or as early as possible. And lastly, understanding the student is the best way for both you guys to get the most out of the placement as well as for the students, and it to be as less stressful for you as possible. Have a chat with the student. Establish what are their goals, what educational opportunities can you and your organisation provide them with, aligned with these goals and with the placement objectives. Establishing honest and open communication ensures that students feel safe, asking you questions as well as seeking out opportunities. It also sets the baseline for what you will offer the students and in return, what you can expect from them. So set clear feedback expectations. Be clear that the purpose of the placement is to practice, grow, and reflect and improve. And you'll be doing this through regular feedback, either on the fly or advantageously, or planned feedback sessions. And how you structure this depends on what works within your work week. Provide numerous educational opportunities using various or several teaching methods, such as written, verbal, or physical, and this can really improve the student learning and comprehension. So lastly, the student is not an empty bucket for you to fill. Think of them holistically as you would a patient or client. Consider adult learning principles, such as acknowledging prior knowledge and experiences, and also considerations for things are, where are they? Are they from a city or rural area? Do they feel socially connected or disconnected, isolated, or unsure? Think about why you live and work in the rural area, community, and think about that in terms of work-life balance, broader skill sets, more responsibility, all those sort of things, and how far a student is out of their comfort zone, impacting their learning whilst on placement. That's enough from me. I'll hand over to Cass now to continue through discussing clinical supervision.
Thanks, Brett. For the second half of this webinar, we'll look at the definition of the clinical supervisor role and the activities and responsibilities required. We'll also explore the use of assessment and feedback for students and who can participate in these aspects of the placement. We should note at this point that the terms clinical educator and clinical supervisor are used interchangeably to reflect the variable role clinicians have in hosting students for clinical placements. Clinical placements can range from short observation-based clinical settings to new graduate level placements that require them to work within a similar scope of practice to a fully qualified new graduate clinician. The knowledge and skill of a clinical supervisor must be flexible to accommodate those really broad needs. Generally, a clinical supervisor has at least 2 years of practice experience, is deemed clinically competent and confident in themselves, and is capable and willing to participate in the student educational experience, and that willingness is extremely important. Participation in clinical supervision has benefits for both the clinicians and the staff of the host organisation. This list highlights 7 benefits, but actually the most important ones are probably the first 3. To teach is to know, critical thinking, and evidence-based practice promotion. Teaching students encourages you to critically think about your practice. Why do you do things in a certain way? Or to rationalise your decisions. Teaching students can help you keep honest. Students can also participate in the development of resources, quality improvement projects and research. They can also assist in the management of clinical caseload. Students can enhance collaboration and communication within the workplace, and placements are also a fantastic way to promote your service to potential employees. As with all things, preparation is key for success. Preparation should be considered at all phases of the placement to maximise the chances of successful outcome and educational experience, including before the placement starts, at the start of the placement, during the placement, and at the end of the placement. And some key points should be noted. assessment is a crucial component of all placements. It is used to gauge the student involvement in the clinical process and to identify areas of skills and knowledge proficiencies and/or deficits. Ultimately, clinical assessments are used to determine clinical knowledge and the application of skills to achieve competency in practice. Formal assessments are often stressful for students and can feel anxious about the process. And to help mitigate some of the stress and anxiety, providing timely and constructive feedback is essential. Giving and receiving feedback is actually a learned skill that takes time and practice. And as a clinical supervisor, we are sure you've had your fair share of positive and negative experiences in this regard. We know that regular, constructive, supportive, and sensitive feedback is important for learning and can positively impact on motivation, knowledge, and skill development. Students commonly report that they do not receive timely feedback or that it's not adequate. There are many reasons for this, including time constraints, complexity of paperwork, and workload issues. If you're having problems in providing feedback or completion of assessment items, start with a consultation with the workplace learning academic staff from the student's uni. They can help guide you through the process. This is a great summation of the concept of feedback and why it's important. Specific information about the comparison between a student's performance and a standard given with the intent to improve the student's performance. On the first day of placement, conversations with the student should include, I will be providing you with feedback on your performance throughout this placement. And this will ensure that it's not a surprise to the student. Be mindful to include both positive and constructive or formative feedback on a regular basis, even for small or simple tasks. This will set up a precedent of regular feedback and build a rapport between you and the student. Try not to make it awkward. Feedback doesn't always have to be formal. You don't have to sit down for a scheduled debrief every day. Try to include it in your regular interactions. For example, remember to wash your hands after you see a patient, or you really got on well with that patient. He really seemed to feel safe talking to you just now. When providing feedback, being specific, timely, and concise are all very important. Consider the behaviour or what they said or did, and try not to focus on personality traits or who they are as a person, and that is not constructive, nor is it relevant. Questions are often raised over who can provide feedback to students on placements. A formal assessment is generally completed by the assigned clinical supervisor or educator with other people contributing. Feedback that needs to address competency or poor behaviours is best delivered by the supervisor overseeing the student. Confirmation of hours may need to be completed by others given time constraints and part-time work arrangements. If you're in doubt, consult your discipline-specific paperwork and the placement handbook. Be encouraging, praise and celebrations can be delivered by anyone in the workplace. The take-home messages from this webinar include: we are training and supporting our future colleagues, and that's important to remember that we're moulding people for future practice. And it's a really good way to keep your finger on the pulse of current best practice and what they're actually teaching at university. Keeps you current. Learn with and from the students, and being prepared is ultimate to success. Providing feedback can be challenging, yet it's a really necessary component of clinical placements. At Three Rivers Department of Rural Health, we have a range of professional development opportunities. We have other recorded webinars on various topics. We also have live webinars and deliver face-to-face events. We also have a suite of online modules for both students and clinicians, which can be completed in any order at your leisure. So please pop in and see our website for further details. Thanks for listening. There's certainly some references used throughout the webinar, and some of them might be useful to you if you're wanting to click on those for more information. Thanks again for your time. We've got an evaluation page so you can get an attendance certificate, and if you just click on the link, we'll be able to fix that for you. Thank you.
Thank you very much.